Hi, I'm Dr. George Ho of Vancouver. This video is an introduction to my Kindle book, A Cost-Effective Way to Cure and Prevent Plantar Fasciitis. The typical major complaint of plantar fasciitis is heel pain. The most common cause of plantar fasciitis is the repeated pressure of the uneven worn heel of the shoe, injuring the plantar fascia. This book puts together proven way to cure plantar fasciitis with the combination of immobilization, acupuncture, and rehabilitation. Please read this disclaimer carefully. Please read this disclaimer carefully. In balance and the weight well distributed evenly, it would be like the foot standing and with the plantar fascia nicely evenly stretched like this. However, if your shoes have become like this and then the support is missing, this is the right shoes and then the support is missing on the right outer side, and then this is the left, and then this is the right shoes. This is the normal better one with better support. This is a pictorial representation of the movie I have just shown you, and the top pictures of the right shoe showing the right outer side being worn out, and then the support of that part of the foot is weak, giving it the chance to be injured by repetitive strain injury. If you look at the middle picture, is the aponeurosis of the hand. If the weight of the hand is evenly distributed, there won't be any point of pressure, point of stress. Similarly, the plantar fascia of the bottom of the picture, you can see that the heel will be most stressed. The plantar fascia is not shown in the bottom picture. The intrinsic muscle, the most important intrinsic muscle, is shown on the bottom of the other three pictures. A working diagnosis of plantar fasciitis can be made just from the history of the patient. A typical history will be the heel pain is the worst during the first few steps when getting up from bed and start walking in the morning. Then after you walk for a little while, the pain subsides. And then after you rest by sitting or lying down for a while and get up and then walk again, the pain recurs. So the cycle keep on and on. Now, if you have this history, you can establish that you have plantar fasciitis. And then contrary to what people think, the bone spur shown on the lateral view of the heel you cannot use that to establish a working diagnosis. Many people have that kind of bone spur without any pain at all. It has been shown that plantar fasciitis can be treated and cured by immobilization of the injured foot, putting it into a ski boot-like variable cast for 4 to 6 weeks. And the picture shown is an alternative called a camp walker. From clinical experiences, many people and doctors know that acupuncture can treat plantar fasciitis very effectively. The scientific theory is as follows. Then when the needle inserts at the point of convergence of the network of interstitial connective tissues, The stimulation will stimulate the network to produce physiological changes that facilitate the conduction of body signal like production of endorphin and other anti-inflammatory cellular responses, and that will cure the inflammation. But you have to rehabilitate the weakness of the intrinsic muscle of the injured foot in order to stop it from recurring. Rehab your intrinsic muscle of the feet. You have to do it like this. Otherwise, you will just walking. There's very little exercise done to the intrinsic muscle of the feet. I have put together a rehabilitative program for plantar fasciitis by applying a newly devised scientific way called integrative body-mind training that simultaneously stimulate the mind and the body with three variables. The first variable is to concentrate the mind with set of imagery, and then the second variable is to put the injured part in extreme traction so that there will be more blood and oxygen attracted to that part, and then thirdly by a special form of breathing. In this book, I have delineated the basic foot rehab program, which I have expanded into another book that combines Chan walking with meditation. This book, Treadmill Ram Tai Chi, modernizes the hard-to-learn Tai Chi move into walking with your dantian. If you have acquired the internal dantian kung fu, the suction of your dantian lightens the gait very much. I acquired my dantian from Cantonese opera singing and singing with the pharyngeal voice as taught by Professor Lin Zhenxing. The meditation part are from Master Nam's various teaching. To see all my Amazon book, which I have published over 20, please Google George Ho Amazon and click on the first link that appears like that, and the website will appear. Hi, I'm Dr. George Ho. This concludes the movie, and if you like this movie, please click like and please share it with your friend in other media like the Facebook. And it would really motivate me to make more movies like this if you would subscribe to my channel. Thank you very much for watching. I'm Dr. George Ho of Vancouver. Thanks again. Goodbye.